Let's discuss face reading on headache. Headaches are conditions caused by external attacks and internal injury leading to twisted, spasmodic meridians or the failure to replenish the meridians blocking orifices. According to the International Headache Society, headaches are classified into primary headaches, secondary headaches, and other types of headaches. The onset of headaches is often episodic, mostly on one side. It can happen from once a day to once several weeks, which with each episode lasting from several hours to several days. With severe headaches, there are accompanying symptoms such as distension in the eyes and perspiration. The condition can be found at any age groups, but is more common in women. The onset is sudden and recurrent, and it can be induced by fatigue, insomnia, and emotional agitation. Face reading. Loss of eyebrow hair on one side is mostly caused by trigeminal neuralgia. The nose tilting to one side often indicates frequent headaches. Capillaries shaped like a match head in the white of the eye suggest headaches caused by traumatic head injury. So as illustrated, loss of eyebrow hair on one side and capillaries in the white of the eye. Therapeutic methods. When experiencing a headache, you can alleviate the symptoms by making adjustment in your lifestyle, such as diet, exercise, and mood control. Dietary advice: eat foods rich in magnesium, such as cashew nuts, almonds, or bananas, to relieve headache symptoms. Avoid alcohol and overconsumption of foods high in fat. Exercise. Exercise is one of the most effective ways to prevent headaches because exercise can help alleviate tension and stress and relax the mind. Emotional adjustment. Maintain a balanced emotional state. Listening to some quiet, relaxing music can regulate your mood. At the onset of a headache, close your eyes and meditate with the music on to divert your attention, which can relieve the headache for the moment. GB8. Moxibustion. Ignite a moxa stick, keep it 3 to 5 centimeters away from the Xiaogu point and apply mild warm moxibustion for about 10 minutes until a warm sensation is produced. Do it once daily. During the onset of a headache, moxibustion of the Xiaogu point can clear away heat and dispel wind to relieve headache symptoms. Massage. Press knead the Feng Chi point 200 times with the pads of your thumb. The intensity should increase gradually until a distension is produced. Do it once daily or twice a day for severe headache patients. This massage can dispel wind and relieve the exterior to alleviate headaches as a result. Massaging the Baihu point at the onset of a headache is also effective for addressing headache symptoms. Thank you for your attention. Let's discuss interviewing vaginal discharge part 2. Letter A, white vaginal discharge. Spleen Chi deficiency. Profuse white vaginal discharge that is aggravated by exertion, sticky without offensive odor, poor appetite, tiredness, slight abdominal distension, pale complexion, loose stool, pale tongue, empty pulse. Kidney yang deficiency. Profuse and dilute white vaginal discharge, no offensive odor, backache, dizziness, tinnitus, feeling cold, weak knees, bright white complexion, tiredness, abundant clear urination, pale and wet tongue, deep weak pulse. Number 3, cold dampness, profuse and sticky white vaginal discharge, a feeling of heaviness, abdominal fullness, sticky taste, thick, sticky white tongue coating, slippery, slow pulse. Number 4, damp heat, white vaginal discharge that may look like a curdled milk. Offensive odor, a feeling of heaviness, thirst with no desire to drink, vaginal itching and redness, sticky yellow tongue coating, slippery rapid pulse. Letter B, yellow vaginal discharge. Number 1, damp heat. Yellow profuse vaginal discharge, sticky with strong odor, vaginal redness and itching, a feeling of heaviness, abdominal fullness, thirst with no desire to drink, sticky yellow tongue coating, slippery rapid pulse. Number 2, spleen chi deficiency, chronic pale yellow vaginal discharge, abundant and dilute, no strong odor, irregular periods, heavy period, poor appetite, tiredness, slight abdominal distension, pale complexion, loose stools, pale tongue, empty pulse. Letter C, red-white vaginal discharge. Number 1, damp heat. Red-white vaginal discharge, abundant and sticky, vaginal redness, itching and swelling, abdominal pain, painful urination, abdominal fullness, a feeling of heaviness, thirst with no desire to drink, sticky yellow tongue coating, slippery rapid pulse. Number 2, liver chi stagnation with damp heat in the liver channel. Red-white vaginal discharge, predominantly red, abundant and sticky with strong odor, vaginal itching, abdominal distension and pain, irritability, dizziness, hypochondrial pain, unilateral sticky yellow coating, wiry, slippery pulse. Number 3, liver and kidney deficiency with empty heat, red-white vaginal discharge, scanty and dilute vaginal burning and itching, difficult urination, dizziness, tinnitus, night sweating, 5-palm heat, red tongue without coating, floating empty and rapid pulse. Letter D, 5-color vaginal discharge. The 5-color vaginal discharge may be watery like a rice soup, like bloody water or like pus, usually with an offensive odor. The 5 colors are white, yellow, red, green, and dark brown, like soya sauce. Next is damp heat, 5-color vaginal discharge, abundant and sticky with an offensive odor, a feeling of heaviness, abdominal fullness, thirst with no desire to drink, a sticky taste, sticky yellow tongue coating, slippery rapid pulse. Number 2, liver and kidney deficiency with empty heat, 5-color vaginal discharge, scanty without odor, vaginal itching and redness, dizziness, tinnitus, night sweating, 5-palm heat, red tongue without coating, floating empty and rapid pulse. Number 3, cold in the lower burner, 5-color vaginal discharge that is watery, with an offensive odor, feeling of cold, abdominal pain, painful periods, pale tongue, tight pulse. Number 4, liver chi stagnation with damp heat in the liver channel. 5-color vaginal discharge without odor, abdominal distension, hypochondrial pain, bitter taste, thirst with no desire to drink, irritability, tongue with unilateral sticky yellow coating, wiry, slippery pulse. 5, toxic heat, profuse yellow blood-stained vaginal discharge, offensive odor, feeling of heat, thirst, dark urine, red tongue with sticky yellow coating, overflowing, slippery, rapid pulse. Thank you for your attention.
Let's now discuss Sun Chan, third interval of the Han-Yang-Ming large intestine meridian. LI3 or Sun Chan is on the radial side of the distal part of the second metacarpal bone. It is the wood point and the shoestring point of the large intestine meridian. The smooth flow and impetus of wood chi to move up and out everywhere can assist large intestine when it has become stuck, constipated, irregular in body, mind, and spirit. The resulting toxicity can impair the functioning of the large intestine. It may cling on to past glories or old hurts, disregarding what is of value and nourishment currently, and refusing to contemplate change. The forward-looking nature of wood and its associated power of birth can refresh and invigorate the large intestines, potentiating change and development. Conversely, at times, the large intestine, which is supposed to complete the work of refining the digestive juices, extracting and distinguishing what is valuable and expelling what is not, becomes overly focused on endlessly refining, and obsessive dissection and perfectionism can occur, a kind of hyperactive peristalsis. This can be as alienating for the sufferer as it is exasperating for those around them. Wood, with its ability to call a halt and its decisiveness, can help the large intestine broaden its outlook and have a fresh perspective. Li3 regulates the large intestine. It invigorates the large intestine meridian and clears heat. It dispels wind heat as it is a wood point and brightens the eye. It benefits the throat due to the pathway of the large intestine. Interval or space in the names of Li2 and 3 refer to the anatomy, the depressions distal and proximal to the second metacarpal bone. Li3 is indicated for negativity about the future. For constipation at any level, it is a local point for arthritis of the hand. It is for acute eye inflammation. It clears heat from the large intestine for constipation. Although not a frequently used point, it can be helpful in cases of constipation. It is similar in its effect on Li2. It can have a marked effect on children, especially for throat disorders, constipation, or diarrhea. For a person who has a negative view of life, this point can help bring the hope and forward-looking influence of wood to the metal. It is a local point for arthritis of the hand. Thank you for your attention.
Differential diagnosis of polycystic ovary syndrome. Western differentiation. Polycystic ovary syndrome is characterized by enlarged ovaries with multiple small cysts and abnormally high number of follicles at various states of maturation, a thick scarred capsule surrounding each ovary. Polycystic ovaries are 2 to 5 times larger than normal ovaries. An international consensus definition of PCOS requires at least 2 of the following criteria: reduced or no ovulation, clinical and or biochemical signs of excessive secretion of androgens, and or polycystic ovaries, the presence of at least 12 follicles, 2 to 9 millimeters in diameter, ovarian volume in excess of 10 ml or both. Signs and symptoms: abnormal, irregular or scanty menstruation, amenorrhea, pelvic pain, tendency for weight gain or obesity, insulin resistance or diabetes, infertility, hirsutism or excess hair growth on the face, chest, stomach, thumbs, or toes, decreased breast size, acne, oily skin or dandruff, male pattern baldness or thinning hair. Contributory factors being overweight, insulin resistance, raised levels of luteinizing hormone, raised levels of testosterone. Diagnosis based on signs and symptoms, discovery of multiple cysts on ultrasound screening, blood tests to establish levels of key hormones. Incidence, women are usually diagnosed in their 20s and 30s. Complications include infertility, high blood pressure, diabetes, increased risk of endometrial cancer, possible increased risk of breast cancer. Chinese differentiation. Diagnostic questioning according to emotions and PCOS. Anger, frustration stagnates qi blood. Sadness, grief affects lungs, heart. Worry, overthinking affects spleen. Prolonged fear depletes kidney qi. Symptoms: history of infertility and no periods or scanty periods, tendency to overweight, hirsutism, feeling of oppression of the chest and heaviness in the abdomen, excessive vaginal discharge, kidney yang deficiency accompanied by phlegm and or dampness. As above, accompanied by pain, blood stasis. Tongue and pulse: pale swollen tongue with sticky white coating, forceless slippery pulse. This is kidney yang deficiency, accompanied by phlegm and or dampness, pale purple or bluish purple swollen tongue with sticky white coating, forceless slippery pulse, kidney yang deficiency accompanied by phlegm and or dampness with stasis of blood. Etiology, excessive physical work, hereditary weakness, kidney essence, wrong diet. This is qi yang deficiency. Dysfunction in Chong branch channels, lung 7 on the right, kidney 6 on the left. Zhangfu patterns, kidney yang deficiency accompanied by phlegm and or dampness, kidney yang deficiency accompanied by phlegm and or dampness, and stasis of blood. Thank you for your attention.
Let us now talk about auscultation and olfaction. The topic is respiratory sounds. The lung governs qi and controls respiration. The kidney governs the acceptance of qi, and these two organs together regulate respiratory functions, so that abnormalities of respiration mainly reflect dysfunction of the lung and the kidney. The main respiratory abnormalities are dyspnea, wheezing, shortness of breath, and sighing. Dyspnea is rapid and labored respiration, often with a sense of urgency. In severe cases, there is gasping for air with open mouth, flaring nose, and lifting of shoulders, and the patient refuses to lie down flat. Dyspnea may be of deficiency or strength type. In the strength type, dyspnea begins abruptly. The breathing is loud, coarse, and rapid, with a sense of relief upon exhalation. The strength type of dyspnea is mainly caused by strong exogenous pathogenic evil blocking the lung or turbid phlegm impeding the lung. In the deficiency type, dyspnea appears gradually and becomes chronic. The breathing is weak and slow with a sense of relief upon inhalation. The deficiency type of dyspnea is mainly due to damage and depletion of lung qi and inability of the kidney to accept qi. Next is wheezing. It's a rapid respiration with whistle-like gurgling in the throat. It has two main causes. One is a cold evil invading the lung and activating dormant room. The other is phlegm heat accumulating in the lung so that the lung qi cannot rise and qi and phlegm battle each other. Wheezing is often accompanied by dyspnea. If the patient breathes feebly and shallowly with a soft sound but appears natural, the patient is said to have shortness of breath. It is a sign that genuine qi is deficient and the body is weakened. The next one is sighing. It often occurs when lung qi is stagnant or the patient is emotionally dissatisfied or depressed. The patient has a sensation of fullness and oppression in the chest, which can be momentarily relieved by taking a deep breath and letting it out. The definition of pathological respiration is that respiration changes in rate, rhythm, smoothness, strength, and sound quality. Abnormal respiration is the external manifestation of pathological changes in the lung. The pathomechanism is the lung is the organ that's most directly involved with respiration. When there is upper stifling breath, the respiration is rapid, with exhalation more evident than inhalation, and may be accompanied with shortness of breath and edema of the face and eyes. The pathogenesis is lung qi rises upward to the throat and obstructs the air tract. For heat wheezing, it occurs during summer or fall and is induced by hot and dry weather. When the wheezing is with rapid respiration, loud, heavy, and rough sound, the accompanying symptoms will be thick yellow phlegm, red face, thirst, slippery and rapid pulse, and the indication is phlegm heat accumulation in the lung. When there's dry wheezing with little or no phlegm, rapid respiration and soft voice, the accompanying symptoms are night sweats, dry mouth and throat, a thin and rapid pulse, and the indication is yin deficiency with phlegm. For upper stifling breath, the symptoms are rapid breathing and exhales more than inhales. The pathogenesis is lung qi obstruction. Thank you so much for your attention.
Let's now proceed to diagnosis according to Zhangfu organ patterns with liver imbalances. The liver is not directly involved in the production of qi, blood, or jiniye, so there are very few liver deficiency patterns of imbalance. The liver has the important function of ensuring that qi flows freely and unhindered throughout the whole body. This means that the liver has a determining influence on the movement of qi and blood in the body, and liver imbalances will often be involved in imbalances in other organs. There is often a focus on liver qi stagnation when analyzing pathological conditions and the way in which liver qi disrupts and blocks other organs' qi ji or qi mechanisms. It is, however, important to remember that this is a pathological condition. When the liver is in balance, it has the important function of supporting the other organs' qi mechanism and the movement of qi and blood in the body in general. The liver is also a reservoir for blood. This means that blood imbalances often affect the liver and blood can be affected by liver imbalances. The liver is the general, whose task is to plan and create strategies. This task is closely related to the liver shen aspect, the hun. One of the aspects of the hun is that enables us to have vision, to imagine something in the future that has not happened yet. This is what we utilize when we lay out plans and strategies. We have a vision of how the future might be. People with a strong hun have a clear idea of what they want. They have goals and they pursue them, whatever the cost. The liver also defines our boundaries. If the wood face is strong, a person can set their boundaries in relation to others. If the liver is weak, a person often gets stepped on and they have difficulty saying no or stop to others. If the liver is deficient, the person lacks a strong vision of what they want for themselves or they lack the courage to pursue their goals. When they meet someone with a more powerful hun, they get brushed aside by this person's momentum or they give up when somebody criticizes them or has a different meaning. On the other hand, if a person has an overactive liver, they do not respect other people's boundaries. Their needs comes first because they have a vision of what they want. They do not care about other people's vision if they conflict with theirs. Liver qi should ideally be flexible like a young tree. It should have the strength to grow upwards and outwards to fulfill its potential, but at the same time be flexible enough to be able to bend and withstand pressure when the wind blows or when there are physical obstacles in its way. It should not be stiff and brittle, as this will eventually cause it to snap, but it should not be weak and limp, letting itself be overshadowed and crowded out by others. As humans, we are social beings and we should be flexible enough to accommodate the visions and needs of others, not just steamroller everyone and everything that stands in our path, but we should also be determined enough to accomplish our own dreams and visions. Most politicians and business leaders have a strong hun. They have a clear vision of how they think things should be and a strategy to achieve these aims. They have no problem sacrificing other people if it helps them achieve their own goals. On the other hand, the liver qi stagnates violently when there is someone or something that blocks them from achieving what they want. Artists are another group that have a strong hun. They can look at a lump of clay or a blank canvas and see a picture of art, which they are then able to bring forth. Many athletes also have a strong hun. This is what enables them to be able to push themselves beyond their physical limits. They are able to overcome both fatigue and pain in order to achieve their goals. This tendency can be recognized in some clients. They push themselves harder than their bodies, that is, qi and jing, are able to sustain in the long run. These people often develop kidney deficiency imbalances because they consume more qi than they can produce. It is often these kidney symptoms that are the reason that they seek treatment. Thank you for your attention.
Inspection, skin color. Inspection of skin color attempts to assess the state of an illness by the coloring and luster of the skin, since their changes reflect the state of visceral qi and blood. In Chinese medicine, 5 skin colors are of clinical importance: blue, red, yellow, white, and black. They are referred to as the 5 colors, and each corresponds to one of the Zhang organs. The color of the skin reflects the nature of the illness and the abnormalities of the visceral organs. The luster of the skin, which indirectly measures the skin state of hydration, principally reflects the ampleness of the visceral organs' essence and qi. Changes in skin color and luster are best understood because they are so readily observed. The face is rich in capillaries. It is therefore well supplied with qi and blood. Essential qi of all the Zangfo organs reach upward to the face. Also, the skin of the face is tender and thin, so that changes in color or luster are readily observable. For these reasons, observation of facial color and luster is the main part of inspection of skin color and luster. Characteristics of normal skin color. Normal skin color results from the blending of the 5 colors and the color of blood. It is bright and lustrous. A normal skin color indicates that essential qi, blood, and fluids are ample and that the visceral functions are normal. Normal skin color has a primary color and a secondary color. The primary color is the normal color of persons of the patient's racial group. In a place like China, where virtually most of the people are of one race, this is a simple matter. But in a place with many races, hence persons with many different primary skin colors, it is very important to bear this in mind. Also, because of differences in the body's constitution and other factors, even persons of the same race may show some variance in their primary skin color. Because the human body is in communion with its natural environment, normal skin color also varies with the climate, the season, and the living conditions. This is known as the secondary color. For example, the complexion turns slightly blue in spring, slightly red in summer, and slightly yellow in late summer, and it is lighter in autumn and darker in winter. Age, diet, pattern of physical activities, changes in the emotional state, occupation, and amount of exposure to sunlight and wind, all these also affect the skin color. So long as the skin color retains the characteristics of normal skin color, it is still considered normal. Abnormal skin color may be dull and withered in appearance. It may be bright and more vivid in hue than normal. It may be a single color unblended with the color of blood, or it may show changes because of the season or climate. The complexion also varies with the physical condition of patients and the severity of the illness. In terms of prognosis, it can be classified as favorable or unfavorable. In general, a favorable complexion is one that, though abnormal, is still lustrous. It indicates that the pathological changes have been relatively mild, visceral essential qi has not become deficient, and stomach qi is still sufficient to nourish the face. Hence, the prognosis is good. Conversely, a complexion that is abnormally vivid or withered and dusky is unfavorable. It indicates that the pathological changes have become severe, visceral essential qi has become deficient, and stomach qi is exhausted. Hence, the prognosis is poor. The plain questions contains descriptions of 5 favorable and 5 unfavorable complexions. The 5 favorable ones are blue as a kingfisher's feathers, red as a cock's comb, yellow as a crab's abdomen, white as lard, and black as a crow's feathers. The 5 unfavorable ones are blue as withered grass, red as clotted blood, yellow as an unripe orange, white as dried bone, and black as root. Thus, the key in observing facial complexion is this: whatever the color, if it is lustrous, it is favorable. But if it is withered and lusterless or excessively vivid, it is unfavorable. The former indicates that qi and blood have not been depleted, so that though ill, the patient can be cured. The latter indicates that essence and qi have been depleted, so that the illness is critical and difficult to treat. Thank you for your attention.
Let us now go to epigastric pain. Let us talk about a case history of retention of food. This is a case history of a 45-year-old woman who had been suffering from epigastric pain for 2 years. The pain was dull, worse lying down, aggravated by pressing on the area, and accompanied by a slight nausea and acidity. When the pain was bad, she also became constipated and her appetite decreased. She also had a slight feeling of fullness. Besides this problem, she had also experienced some slight bleeding in between periods with light fresh blood for 4 months. Her pulse was slippery on the whole and weak on the right side. Her tongue was pale with a slight bluish-purple tinge, teeth marks, and a sticky white coating. Here we can see a person's tongue with spleen Qi deficiency and excess due to retention of food. Her condition is a mix of deficiency and excess. There's a deficiency of spleen Qi manifesting with poor appetite, dull epigastric pain, bleeding in between periods, weak pulse, and pale tongue with teeth marks. The excess condition due to retention of food manifests with constipation, nausea, pain which is worse for pressure, and on lying down. It was also determined due to the slippery pulse and the sticky tongue coating. The treatment principle adopted was to tonify spleen Qi and resolve retention of food. It was not necessary to deal with the stasis of blood directly, as this will resolve by itself once spleen Qi is tonified and food retention is resolved. The points used were REN 12, stomach 36, spleen 6, bladder 20, bladder 21 with the reinforcing method to tonify stomach and spleen Qi. REN 11, stomach 21, stomach 40 with even method to promote the descending of stomach Qi to resolve retention of food, and pericardium 6 with even method to subdue rebellious stomach Qi, causing nausea and acidity. Thank you so much for your attention.